coming up, as we just heard. Well, as the temperature drops, the number of cases of kids getting sick inevitably rises, and it's certainly the case in my house. So if you're a daycare parent or a parent of just young kids in primary school, we thought what better time to find out how best to protect your family and just survive this season. Joining us is infectious diseases expert and mum, one of our favourites, Dr. Linny Fong. Hello, Linny, so good to see you. We've been planning this chat for a while.
We have been, but
of course our households got sick, so we had to delay it.
Exactly.
Which just feels like so many Australian families are going through this now. And first I want to ask you, just the challenge of getting through when you're trying to juggle work. Perhaps you're back in the office a lot more now. You're trying to do drop-off, but often your kids are too sick for daycare. You don't have care. It just is a really particularly stressful time.
That's right. Gosh, it's so challenging. And this winter has been, has been a pretty bad season in terms of all the viruses and all the, the gastros and everything's kind of come out. And gosh, when you're juggling your own schedule, your kids' schedules, and then that buffer, like it's so difficult.
Any tips? How do you get through this time? Just steel yourself for the week ahead.
Goodness, I think I think we've been riding it out. So I feel like we're sort of doing as all the other households have, and doing it a little bit tough during that winter. The initial couple of weeks. And yeah.
Let's talk about little kids in particular, because their immunity, if I'm right, is probably not as advanced as older kids and then adults as well, because they're just hitting things for the first time. Tell us about some of the things we need to be careful of this season. I know RSV has been big in my house, flu. There's lots to look out for.
Yeah, of course. So speaking with my colleagues across the different states, certainly what we've been seeing is a lot of RSV and flu.
What is RSV?
Yeah, and it's a really good question. So it stands for respiratory syncytial virus, and it's essentially a virus that causes inflammation within the chest and within the lungs. And it can cause quite severe illness in young babies. It can give them bronchiolitis, so that really bad inflammation and difficulty breathing. And then in older individuals, it can cause quite, severe illness as well. So yeah, it's essentially a virus. It's, there's plenty around. I think what will be really interesting will be what will happen over this season as we've introduced the monoclonal antibody in some states. So, New South Wales, Western Australia and Queensland have nirsevimab. It'll be interesting to see what happens in terms of numbers in those particular states.
Interesting. So this is quite emerging.
Yeah, so this is that sort of that groundbreaking, medication that hopefully will change things, and we'll see what happens over the next couple of years.
What about flu and COVID for our little kids?
Yeah, so flu, I think the main thing is that certainly people are still asking about whether or not they should be vaccinated. And what we found, and the stats earlier this year show that only 15% of under 5s are vaccinated against the flu, and we know it's a free vaccine for this particular age group. But yeah, certainly people don't realise that, one, they need to get it every year, and that perhaps that flu can be quite a serious illness. And so, just reminding people that, it is out there and that it's worth doing is quite important.
Yeah, really. But particularly if it's free,
we would have thought that would be a nice incentive. Yeah. But I think people forget that healthy kids do get unwell.
What are some signs to look out for? Like if you're having a rough night, sometimes you think, oh gosh, will this night be, any different to next night? Should we go to the doctor? Like, what are some signs you would say to have a look at?
I think so. With some of these respiratory illnesses, like the symptoms are so non-specific. To start with, fever, a little bit of a runny nose, or a little bit of a sore throat, and then certainly in terms of the things to look for and things where we worry is where the breathing starts to get affected. So when you see that your child is sort of struggling to breathe or breathing a bit faster, that can sometimes be a sign. If they're not able to take anything orally, so not able to keep their fluids down, or if their fever is going for a long period, or they're developing unusual symptoms, so rashes and becoming sort of sensitive to light.
Okay, really good tips. And there's one more I want to ask you about. I'm going to say this wrong, but mycoplasma, is that how I say it?
Mycoplasma, absolutely. So this is an unusual bacteria, and we're seeing quite a few cases. Every 3 to 4 years we see a sort of a spike in cases of mycoplasma, and it's certainly something that my GP colleagues are talking a lot about as well. What it causes is, again, it's called a walking pneumonia. So a lot of people have other symptoms with it. So a headache, they might feel, muscle aches and pains, they might have rashes, but then they have this almost like this wheeze or this difficulty breathing that doesn't go away. And it's a bit more challenging because it doesn't respond to normal antibiotics. They often need different antibiotics. And so, it's really about sort of making sure that they're monitored and tested if needed and then receive the appropriate treatment.
Okay, another one to keep
Another one to
eyes
keep an eye on
as we get through this winter.
Correct.
Let's have a look at some of your top tips if you're out there having a bit of a rough time. These are Linny's top tips. Take us through it.
So definitely we can't forget hygiene.
Yeah.
We always, during COVID we talked a lot about washing hands, but it's also sort of covering your coughs and sneezes, making sure that you're really kind of clean with those things. Definitely keeping up to date with vaccinations. So flu vaccine, COVID and the childhood vaccines are really important. And we saw that drop during COVID. Staying at home when you're unwell, that's super important. And I think the thing is that a lot of people forget that, when you're feeling a little bit of a sneeze or, a little bit of a runny nose, that in other people can actually be a more serious infection. So, just being considerate of others. And then, when you're going into crowded places, thinking about wearing a mask is important.
Yeah, which a lot of us have stopped doing post-COVID, but it's a reminder to get the mask back out.
Absolutely.
Linny, we so appreciate it. Stay well. My top tip
too.
is a few more Bluey episodes. Do not go astray in this season. But yes, it's so good to talk to you, and we'll remember those top tips for this coming winter. Thanks,
Bridget.
Well, a cross-section of Canberra musicians have put on a charity gig this afternoon with all proceeds raised to go to supporting